Yeah, I'll take the stand here. I don't like that. Well, good afternoon now to everybody. Great turnout. This is another great day in Terre Haute, a phenomenal project. You know, we all know, and as what was mentioned by Pat, just kind of about, well, the economy's bad, but healthcare is kind of in a state of where's it going to go. And yet, local folks here have decided to grow their business, and I think that's awesome. I think we're all very excited about UAP Clinic's new addition to the Terre Haute community. You know, I've been going to APNS, UAP Clinic since I was a kid, and it's always been a big part of my family. And you know, it's just exciting to be able to see this next big project in the life of UAP Clinic. This campus continues to grow with what Union Hospital's done and with the Rural Health Innovation Collaborative area up here. This is just the beginning, really. But I'm very excited to be here today and congratulate UAP Clinic on their decision to build this new facility. So congratulations to all involved. It's good to put local folks to work here, and it'll be a great new facility to serve the community for many years to come. Thank you so much.
Introduce Dr. Hans Andreasen, who's served with me for thick and thin as the chair of our board of managing members.
Well, welcome. I'm going to give a little history of where the clinics come from. I mean, you know, this is really an occasion that's a rare opportunity for us. We can look to the future, but we need to reflect on our past. The clinic was put together by Dr. Weinstein and Combs and actually formed Associated Physicians and Surgeon Clinic in 1920 for the purpose of owning and operating an institution for the practice of better medicine through the cooperation of specialties and the supply of laboratory and other equipment not available in Terre Haute at that time. The clinic's first building project was the remodeling of an old home, the Riley McKinney home at 221 South 6th Street that same year. As you know, this is our current location of our downtown UAP clinic. The first major building project was in July of 1958 when the APNS clinic announced a $1 million project at that time to provide a new modern facility. At that time, Dr. Alex Cavins was president of the clinic, and he was quoted in our Tribune Star as saying, "We believe in the future progress of the community of Terre Haute and the Wabash Valley on both sides of the line. This project certainly is evidence of our confidence in Terre Haute. We believe that actions speak louder than words." And I think this same sentiment is true today. I know I speak for all of my colleagues at the UAP Clinic. It is both our privilege and our responsibility to invest in this new state-of-the-art medical facility. It will allow us to continue to provide the medical care that is expected here in the Wabash Valley, and obviously it will complement our wonderful new hospital that we see, you know, in the distance if we didn't have this tent up in cold weather. You know, I mean, I think it's going to be a great compliment to finish this campus. I thank you all for coming on this brisk day, and we're going to let Scott kind of bring us to the hospital side, I think.
Mary told me I had an hour, so I'm okay. Just kidding. From the hospital's perspective, this is truly an honor. We have a mission of providing the absolute best care to the citizens of the Wabash Valley. This is yet another example of how our physicians trust us. I've had the privilege of working in many states and other areas, and I've said this more than once, and I'll say it again. This community is absolutely blessed to have the medical providers that we have. I would put them against anybody in the country. I'd put it against anybody in the state. I would tell you that our campus here is truly a medical complex. We're no longer a hospital. You can get all your care that you need here. There's not one specialty that we don't have. And our relationship with the clinic and with all physicians continues to grow. And that is so that we can serve you as the citizens and our families and our friends. That's what we're about. So this is a great honor for us to continue to complement this medical center that we're creating here. In case you don't know, there are 50 acres here on the north side. There's about 2 million square feet of healthcare complex. On these 50 acres, there's about 5,000 people employed. This is truly an economic engine for our community, and we want to continue to be a vibrant part of this community and provide the absolute best care that we can, and that we do, and we will continue that. And this is just another step to further our development, and I thank you for being here today. And like me, we expect you to watch this, our campus grow. This is another building, and thanks for coming today, and have a great day.
Next, Dr. Krishnan Namburi, who's been a member of our board and also on our building committee.
Well, good morning. It's an honor for me to be standing before you and present UAP Clinic. I do think that there was some questions about why we should be on the campus. For a lot of doctors and staff members were asking why we should be on the campus and the clinic. If you look at traditionally, it is most of the important clinics in this country, the Cleveland Clinic, the Mayo Clinic, and all the brand name clinics are all on the hospital campuses. So we have a pretty good chance that we could be the Mayo Clinic of Wabash Valley. That's one of the important things. The important thing for the patients is going to be the ease and comfort with which they can access to the hospital, to the clinic, and they don't need to worry about where they're going to go, how far the hospital is. The only sad and bad point about being on the campus that I see is doctors will never be able to tell their patients, I got in the traffic while I'm coming from the hospital. Otherwise, everything seems to be a perfect addition to the hospital campus. It's actually a privilege to work in Union Hospital. It's a greater privilege to be on their campus. And I really looking forward to being on the campus pretty soon. Thank you very much.